Welcome to Around Kitsap. This is our video newsletter where we focus in depth on topics important to everyone in Kitsap County. I've invited two folks into the studio today that we have had a very hard time in getting together. These are really busy folks out spreading the news on senior information and assistance and Social Security. So with me is Tanya Weintraub. Tanya is the supervisor with the Senior Information and Assistance Program with Kitsap County, and also she's a volunteer coordinator with SHIBA, and you're going to hear a lot more about that. Tanya's probably got about 4 or 5 hats she wears representing seniors in our county. And also joining us today is Kirk Larson. Kirk is Western Washington Public Affairs Specialist with the Social Security Administration. And that is a real mouthful. Anyway, first of all, welcome.
Thank you.
We have some very important information to share with folks. And as I said, in talking to Tanya and Kirk over the last probably 6 months, I think
so, yeah.
we have really hit and missed on when we can get together. So we locked in this date, and I'm so glad we are here. So first of all, we're going to talk to Tanya. She's got lots of information. First of all, she wants to share the important information about what the Area Agency on Aging is in our community.
Yes. I work with the Kitsap County Division of Aging and Long-Term Care, and at the Division of Aging and Long-Term Care, we are one of over 600 area agencies on aging nationwide. In Kitsap County, we are the designated program. And at that program, we really do a lot. We are responsible for delivery and planning and coordination of services for elders and persons with disabilities. And our real mission is to try to help people remain as independent as possible, as safe as possible, and really try to promote the well-being of older adults and persons with disabilities here in Kitsap. And we have a variety of ways that we do that through many of our programs that we might have out in the community. These are programs you've all probably heard about. Your neighbor Joe who goes down to the congregate meal site and has a hot meal.
Right.
It might be someone who is looking for some help in paying for prescription drugs and needs somebody to look at what programs they might qualify for and help them to fill out applications and really get to those services. And we do that really through one of our main programs, which is Senior Information and Assistance, which is a kind of a front door into other services here in Kitsap County. And Senior Information and Assistance is a program for our elders that are 60 years of age and older, and they can pick up the phone and give us a call. We have live people right there who can talk with them and really ask questions and assist them in trying to look at what we have available here in Kitsap County and connect with those services. And I think one of the important things that I want to say is we can work with people over the phone. We can also have people come into the office
Right.
by
That's
appointment.
what I was going to say. I would think although, you know, nowadays persons over 60 are pretty internet savvy, pretty savvy with the computer, but there are quite a few folks that still want the face-to-face contact, really want to, the phone isn't even comfortable for them.
Yeah.
So if they wanted to come see you, where are you?
We are located at the Givens Community Center in Port Orchard. That is our main office for Senior Information and Assistance. But we have another program, our Caregiver Support Program, with a separate office up at the Silverdale Community Center. And that's also, we have social workers that are available one-to-one and by phone out of that site as well.
Tanya, how many staff members are in the Area Agency on Aging? How many folks like you that are working with seniors?
In our agency, across our programs, are about 30 staff members and some fantastic volunteers. I don't know what we would do without volunteers.
Yeah.
And our staff is, I like to say, a small but mighty team. And it's a quiet service. A lot of times people do not realize that we have people who are in the privacy of individuals' homes helping them one-to-one. Because some of our services, we are available for home visits. The office does the case management for people who are doing getting ongoing services through Medicaid-funded programs, like the COPES program or Medicaid Personal Care, in addition to the other program I spoke of, the Senior Information and Assistance. And with our Caregiver Support Program, we have a respite case manager who may meet with a family member and talk about getting a break from caregiving, looking at different kinds of services that are out there as well. And so
when we talk about caregivers, not to skip ahead, but it kind of cued me, you do work with seniors over 60 and folks with disabilities, including youth, including younger folks with disabilities?
we're actually looking at the family caregiving situations where we have adults with disabilities, and usually it's really a situation of family, friends, neighbors, maybe church, faith community members who have stepped in. Our language is around the unpaid informal caregiver.
Okay.
The idea
okay.
is to look at people who are kind of quietly in the community doing what a lot of us do, helping take care of our spouse, our
Right,
parents.
right.
And so with that program, that's really what we're looking at in terms of our target audience.
Okay.
There is not an age limit, and for all of these programs, it's not dependent upon income or assets. You can come to us and talk with us about services, and our services are free. And then we look to the community to find out what's available to help meet the needs and help people to navigate those choices.
I've worked with members from Tanya's staff before. Excellent service, being able to get out into the community and help people. I mean, the service they provide is outstanding, and it's paid for. It's not anything that costs. As you're able, and people are able to access that.
Exactly. I think that's really a good point to make. The services that Tanya can help you with are accessing Tanya cost you nothing. Now, Tanya and I were talking off camera before we got started. Tanya is a county employee. The funding that enables her to be a county employee comes federal, state. It's a huge, not as huge as it used to be, I bet, but a big pocket of money. Thus, she said there's a nationwide network of area agencies on aging.
There are, and one of the really common questions that we get from families here in Kitsap County is, I'm really concerned about maybe my brother or sister or my aunt or parent who might live back east or somewhere else. And with that, what we're able to do is connect those families with other area agencies on aging for that area.
Exactly.
There's a service called Elder Care Locator. There's a toll-free number and a website that we can provide information on where a family member can confidentially just give the name of the city or a zip code and link to that local area agency on aging.
Excellent.
For similar services.
Excellent, because there are many of us out there. My mother lives in Chicago. Now, fortunately, my sister and brother are there, but there are many of us whose parents went to California, Florida, wherever in retirement age, and they start needing some help. We need to find the resources. So tell us again what it's called, Locator?
It's the Elder Care Locator.
Excellent.
And another way, our local Senior Information and Assistance Office is a starting point. You can always call us there and we can refer you out to the other services.
Excellent, excellent.
And another program that I did really want to talk about today is our SHIBA program.
Oh, that's what I was exactly going to go into.
Great.
Because SHIBA is such a cool name, but I know it's an acronym for something. So what does it stand for?
SHIBA is our statewide Health Insurance Benefits Advisors program. And here in Kitsap County, Senior Information and Assistance is the local sponsor. And the way this program works is local volunteers here from Kitsap are trained with expertise through our Office of the Insurance Commissioner. And SHIBA, the Statewide Health Insurance Benefits Advisors program, links our local Kitsap people to volunteers who can answer questions in an impartial and unbiased way about health insurance and healthcare access. So what do I mean? If you've got questions about Medicare, you've got questions about Medicaid, you're struggling paying for prescription medications.
Okay, good.
Maybe you're on Medicare D and you've fallen in the donut hole, or you don't know if your Medicare D prescription plan is the best one for you. You can access someone who can help you review your options, and they're not trying to sell you anything. They're there to provide unbiased information.
And those volunteers are here in Kitsap with
Yes,
you?
they are. Yes, they are. An incredible crew.
And who does their training? How do they get their training?
We have regional trainers that come to us through the Office of the Insurance Commissioner to deliver training right here in Kitsap to our local volunteers. And people can access resources online at the www.insurance.wa.gov, or call our toll-free number and link to the local volunteer. And
you know, there's so many people in our community that are volunteering, and you don't know there are these people behind the scenes. And I think we could do a whole show on what options are out there as you think about retirement and you have this extra time, and maybe you want to be trained and help people with their insurance. It's just very, very awesome. And how many of those volunteers do you think you have?
our volunteer crew is at about 13 right now, and we have volunteers that are in various roles. Some of those volunteers are helping people one-to-one. Some volunteers are doing public education seminars and really educating on things like fraud and things about like joining in. I'm new to Medicare. What are my choices? How do I work with that? So
wow.
And once again with that, I mean, and this is what I've really been impressed with the SHIBA program. It's not an age, there's not an age thing. You don't have to be a senior, you don't have to be someone that's disabled.
Correct.
You could be anybody that has questions about your health insurance.
correct.
And they're there to
good.
help them, yeah.
Yeah.
Oh, that's great.
Look at health care coverage for children, people who have lost employment and are looking at those options, and people who are looking also at long-term care insurance options. And you know, one of the programs that we're working with the SHIBA program is called the Senior Medicare Patrol Project. And that project is specifically focused on the very important topic of fraud prevention.
Fraud is a huge problem, not just in the insurance industry, but ID theft and the whole thing. It's just, with this modern technology we have in our world, people can become somebody else and take everything, and including your identity. So talk to us, let's talk a little bit about the fraud topic.
Sure. One of the things that we really want to be talking with people about is making sure that they're not giving out private personal information.
And that's the tough part.
Yes. You'll have people who might get trapped by somebody asking for their
they were
Medicare
so
number.
Nice. They were so
Exactly.
nice to me on the phone, and I hadn't talked to anybody for a while. Oh my.
And you know, I think that it's really encouraging consumers to report. If you, and to really be responsible for taking a look. You get these statements in the mail that talk about, I've been to the doctor, you've got a summary notice that tells all your charges. If you see errors or concerns, or you're worried that there might be a situation of double billing or a very clear fraudulent practice where somebody might ask for your number and order equipment on your behalf that you know you never requested. The SHIBA program is a place to call. You can call that number, talk with a volunteer, and we will make sure that a fraud investigation it's moved forward and that your complaint is heard. And it's really one of those things that, like we hear about with so many services, we all can be a part in prevention. Part of it is protecting yourself, but the other part of it is looking at the big picture, and potentially if you've been a victim of fraud, someone else may have been also. And it never hurts to ask.
It never hurts to ask.
That particularly from Social Security's point of view, very important. You know, when you get that medical bill in the mail, and you're saying, you know, that's covered by my insurance company, it's covered by Medicare, you know, still very important for you as an individual, as a concerned citizen, to look at that information and make sure that all those things that are billed on there, actually you had those services done. Because while it may not be money coming directly out of your own pocket, it is coming as a society. It's money coming out of our collective pocket. So very important to look at that statement and make sure that the information on there is accurate.
Very good, very good. Wow, we've opened up a bucket of worms here, haven't we? Really, really great information. We're going to take a quick break and see Kirk's friend, Chubby Checker, do a PSA regarding Social Security. And when we come back, we're going to talk a little bit more with Kurt and Tanya in depth on Social Security topics. Stay with us, we'll be right back.
Hi, I'm Chubby Checker. A new twist in the law makes it easier than ever to save on your Medicare prescription drug plan costs. So what are you waiting for? Go to socialsecurity.gov and apply for extra help. It's easier than learning the twist.
Welcome back to Around Kitsap. We're talking about the Area Agency on Aging, Senior Information and Assistance, SHIBA, Social Security. What else? It's a whole can of worms we've opened up here. I want to remind you, Tanya Weintraub, Senior Information and Assistance, Area Agency on Aging, all things to all people, helping folks age 60 and older in our community, and also Kirk Larson, Social Security Administration. So we're going to finish up a little bit on SHIBA, and then we're going to really talk about some Social Security stuff. So what did we miss about SHIBA?
Well, one of the things I want to make sure and cover with SHIBA is to let people know that, again, it's a local service, and people can call and leave their information, and a volunteer will give them a call back to help answer their questions.
Great.
The other thing that's really important to think about is we're coming up on fall, which is typically an open enrollment period for people to look at their health care coverage choices. Do I need to change my health insurance plan? Do I need to look at changing my Medicare Part D prescription plan that I have that's helping me with the costs of my prescriptions? And I know Kirk's going to talk a little bit about that and ways that we can really help people look at what plan might be best for them, and if they might qualify for programs that help with the cost of prescription medications.
As the world is now, as the healthcare world in the United States is now, there's changes coming. So there's a whole nother what if. So stay
Absolutely.
tuned.
Stay tuned and know.
Stay informed.
Stay tuned, stay informed, and know that SHIBA is an impartial place to get information.
And I think the most important thing is it's not just for folks 60 and older. Anybody with insurance questions
That's correct.
can go to SHIBA.
Exactly.
All right, Kirk, so let's talk about Social Security Administration and how does it, first of all, let's give the whole overview, because it's not just about retirement.
No, that is one of the very important things. When people think of Social Security, they think, oh, retirement benefits.
Yeah.
But it really is a much larger program than that. It really is a program that can touch you throughout your life. Yes, we have retirement benefits, but we also protect millions and millions of workers with disability coverage. If you become disabled and unable to work, you can qualify for Social Security benefits. We also protect families with survivors benefits. You know, if someone passes away, we protect widows and widowers so that you can file on an individual's record later in life. And we also protect minor children with that, meaning if a parent passes away and they have children under the age of 18 or between the ages of 18 and 19, and those children are still in high school, then they can go ahead and draw survivors benefits off a deceased parent's record. As a matter of fact, nationwide we have about 2 million people, 2 million children that receive benefits from that program. And we have an additional 2 million children that get benefits off a disabled worker's record. The disabled individual gets their check for being disabled, and if they have minor children, those minor children get additional benefits. So we have currently about 4 million children that are getting benefits from the Social Security program. And then of course we have spouses benefits, we have Medicare benefits, which we help administrate, many different programs out there that encompass Social Security.
And so Social Security is truly, truly broad, and lots and lots of benefits other than thinking about retirement.
Exactly.
So talk to us about a website. Let's say I've just turned 50. Is there a website I can go to? I know I get a printout from Social Security every year saying, wow, Charlene, you've been working this many years, and holy moly, if you work this long, you're going to get this much. Is there a website someone can access that information?
Absolutely, absolutely. We have a great website. Actually, it's won awards for the information provided and its ease of use. Starting, probably about 15 years ago or so, we started looking at different ways to serve the public. We have offices, 3,000 offices located around the country. But as the baby boomers, that generation of about 80 million people, as they began to approach retirement, we needed to discover other ways to serve those people. So we have the 800 number, which has been great. We answered millions and millions of calls every year with that. But still, we needed to find another way to serve people. So we created our web page, and we have a number of different online services that people can access. And it's real simple. It's at www.socialsecurity, all one word, .gov.
Simple.
Yep. And you can go there, and right on the front page, it'll show you tabs that you can click on for retirement and survivors and disability benefits. One of the really cool things that I like about it is there's frequently asked questions. So if you went to retirement, you could look at the top 50 questions that are typically asked about retirement. So even if you knew nothing about retirement benefits, you could go there and kind of get a self-tutorial. You can see all the other important questions that other people had asked in the past. It's also, we do have the entire website is in Spanish.
Excellent.
And we have many of our other publications printed in 15 different languages. So you can go to our language gateway and find out a lot of other languages and information about Social Security.
Wow.
Yeah.
Very good. So Kirk, let's talk about how do you and Tanya work together? How does Social Security and our Area Agency on Aging, how do you folks work together, and especially to benefit our population that's elderly, 60 and older? That's not very old anymore. 60,
That's not.
60 is pretty young.
It is, yeah.
Well, I'm going to ask you a quick trivia question here. Let's see how close you can get to this. To show you, since you mentioned 60 is not very old, how many people in the United States, in this country alone, are over the age of 100? A number of people. Any guess?
2,000.
2,000. Actually, it's over 100,000 people
Oh,
over the age of 100.
Yeah.
It's always a shocking number. But yeah, you mentioned 60 is not very old. We have
wow.
100,000 people in this country. And the really amazing number is this. By 2050, that number will jump up to 600,000 people over the age of 100, just in the United States alone. That's one of the things I like to...
That just blows me away.
Isn't that amazing?
I just can't believe that.
Yeah.
That's old.
That's all.
Get 100.
100, that's still pretty old.
That's getting to be old. But man, they have really taken advantage of their Social Security.
Exactly, exactly. And I like to illustrate that to people when we talk about when to take Social Security retirement benefits.
That's
very
a
important
whole conversation.
Exactly, exactly. But where we work a lot together is when SHIBA representatives go out and talk to people about their program. And they encourage people to file for other benefits. And one of the main benefits that we emphasize is the Medicare Part D Extra Help Program.
Tell us, what does that exactly mean, Medicare Part D?
Well, Medicare Part D is the prescription drug program of Medicare. And once you reach retirement age, or I should say once you reach age 65, or if you're on disability benefits and now you've also qualified for Medicare benefits through that program, you are potentially eligible to sign up for Medicare Part D, which will allow you to get access to prescription drugs. Now, we created that program back in 2003, and at that time when we created it, we also realized that some people may not be able to afford all their prescription drug medications. So we created the Extra Help Program, which basically, depending on your income and resources, and there are some tests, there are some requirements that you be at a certain income and resource limit, that you can potentially access this program, and it'll pay for all of your prescription drug medications, which on average, it's worth up to about $4,000 per year.
Yeah, that is
in savings.
Excellent.
Yeah.
So Tanya, I know when her people go out and talk about this, we encourage them, and I know we've worked together on a couple of different projects to actually take the applications out and help people fill it out right then to get them signed up for it.
Good. Tanya, are you surprised at how many people don't know about Medicare Part D? Is it surprising?
Absolutely, absolutely. There are many people who maybe thought they wouldn't have to worry about it. They were only taking a few medications. They decided to not even opt into the Medicare D as as a coverage option. And there are also many people who are not aware of the low-income subsidy, the LIS program Extra Help that Kirk was just talking about. Here in Kitsap County, we know that there are hundreds of people who qualify for the low-income subsidy program and also what's called Medicare savings programs, which actually helps pay for your Medicare Part B premiums and some co-pays. And again, it's based on your income and your assets.
Yeah.
It's based on need. But there are people who are eligible who do not even know the program exists. And so one of our goals, and another way that we've worked together, is to provide community educational seminars and opportunities where people from the public can come in, listen to a presentation, and have access to volunteers and staff from our local programs to help get them connected to these services and resources.
Excellent, excellent. I know you sponsored one of those, was it earlier this year, probably in the spring?
In February,
And
yes.
so stay tuned to BKAT, because we always have that information posted, because it's a very good resource. Go to one location and get all this information. Wow, we have really talked about a lot of things today. Let us share once more information, phone number, website to find Tanya.
Sure. Our local senior information and assistance number is 360-337-5700, or toll free at 1-800-562-6418. We're also available online at www.agingkitsap.com. And you can go online, look at information. You can also request to be contacted. There's a request for contact form, and one of our local social workers will give you a call and follow up. That's for the Senior Information and Assistance Program. I also spoke quite a bit about our SHIBA, Statewide Health Insurance Benefits Program, and that toll-free number is 1-800-562-6900, and also is available online at www.insurance.wa.gov. And there are wonderful resources, booklets, pamphlets, similar to what Kirk was saying in terms of being able to look yourself and order materials for yourself, but also to talk to someone.
Very good. Kirk, how about the Social Security? Real simple and get
Real simple. We have,
website.
you can go ahead and call our 800 number, and that's 800-772-1213, and it's open from 7 in the morning till 7 at night. You can just give us a call. Somebody will be able to help you out. Or you can go to our website at www.socialsecurity, all one word, .gov, and get information there. Now, I encourage anybody, if you think that you might be eligible for Medicare Part D extra help, you're having difficulties paying for prescription drugs, very easy application to go ahead and fill out. You can actually do it right online. You can go on. It's 15 questions, very simple to fill out. And the worst thing that would...
I'm sorry.
Oh, go ahead.
You don't have to wait for the open enrollment.
No, for the extra help program, you can do it
get on
anytime.
at any time.
Yeah.
Good.
The open enrollment allows you to go ahead and switch.
Okay.
If you're on one coverage right now, you could switch to another program.
I see. I see.
Which is also very important. One thing I like to say about when you're looking at different prescription drug programs or different insurance programs, you need to remain flexible and not be able to say, this is something I'm going to stick with for the rest of my life. You need to be able to say, every 1 or 2, maybe 3 years, say, I need to make sure that this program is still meeting the needs that I have. And that's where SHIBA, I think, does an excellent job to help people say, okay, let's look at your needs. Let's see what help you need.
And if I might add to that, to encourage people to not wait until the fall, to look at where you are now, ask your questions now, get your research in order so that the choice is easier and you don't feel that you're pressured by a deadline. And also, depending on your situation, you may not need to wait for the fall. If you're a person who also gets Medicaid in addition to Medicare, you have the option to switch plans. When in doubt, give us a call, and we'll review those options with you.
Exactly. Exactly.
Wow, great information. Thank you so much. We could spend another half hour or an hour
I think so, yes.
really in depth about these topics. Please take advantage of the information you heard today by calling Senior Information and Assistance, Area Agency on Aging, SHIBA, Tanya.
All those things.
Get in touch, and also Social Security Administration. Kirk shared lots of good information. Thank you so much for coming in today and sharing and updating our community on this fabulous information.
Thank you.
Thank you.
Thanks for tuning in to Around Kitsap, and we'll see you next time.